The electrical activity of these autorhythmic fibers will determine when the chambers undergo systole and diastole. Systole means the contraction of a chamber, diastole means the relaxation of a chamber. When the atria undergo systole, first they depolarize, here depicted with the color orange, and then they contract as the cardiac muscle within the walls contracts. It squeezes blood towards the ventricles. This contraction ends when the muscles repolarize, here depicted in green. The atria undergo systole first, followed then by the ventricles. When the ventricles undergo systole, once again they will depolarize, here depicted in orange, and then they will contract. This time as they squeeze, they will eject blood from the heart, and then they undergo diastole, here depicted in green, when they relax. Thus, this electrical activity guides both the systole and diastole of the atria and ventricles. During the cardiac cycle, there are two moments when blood would go the wrong way if it were given the chance, going from an area of high pressure to low. To prevent this, there are heart valves. Heart valves swing shut when blood attempts to go in the wrong directions, and so therefore valves ensure the proper flow of blood. One pair of valves are the AV valves, the tricuspid and bicuspid, which lay between an atria and a ventricle. When blood is in the atria, these valves open so that the blood can go in the correct direction into the ventricle. When the ventricles contract, however, this blood attempts to go back into the atria from whence they came. The valves will then shut to prevent this from happening. When these valves shut, there is turbulence in the blood. This causes the first heart sound, which is known as lub. The second pair of valves, the semilunar valves, lay between a ventricle and then the vessel which proceeds from this ventricle. These valves will open when the ventricle contracts to allow the blood to leave. In other words, going from the right ventricle into the pulmonary trunk and from the left ventricle into the aorta. When the ventricles relax, however, this blood would attempt to return to the ventricles. In this case, the semilunar valves shut so that the blood has no choice but to go onward. The pulmonary semilunar valve shuts, preventing blood from going back into the right ventricle, and the aortic semilunar valve shuts, preventing blood from returning to the left ventricle.